But what makes this story even more interesting is that through our research, we have learned the cause, the etiology of what is happening to these patients. Because what we learned is that the reason why these lean PCOS patients in the late 20s, early 30s suddenly drop the androgen levels, the testosterone levels, is because their adrenal glands, which produce roughly half of all androgen, with the other half coming from the ovaries, it's the adrenal glands, it's not the ovaries, that suddenly become insufficient in androgen production. And we also learned that this is with great likelihood an autoimmune process. It's an autoimmune process attacking what's called the zona reticularis, which is one of the 3 layers of the adrenals which produce androgens. How do we know that it's an autoimmune process? Because we find almost universally in these patients that they have a lot of autoimmune problems. Most frequently thyroid autoimmunity, and autoimmunity to thyroid and autoimmunity to adrenals very frequently runs together. That has been known for quite some time. This has yet additional clinical relevance beyond just the fact that it's always good to understand why something happens. Has additional relevance because autoimmunity also predisposes to miscarriages. And we therefore need to give these patients another layer of treatment to prevent them from miscarrying once we succeed in helping them getting pregnant, because the last thing we would want is to finally help them get pregnant and then for them to have a potentially preventable miscarriage. So this hypoandrogenic PCOS, once recognized, is surprisingly frequent. I mean, we were actually amazed how many of these patients there are, at least in a center like ours that serves as a center of last resort. And there isn't a day where we don't see a new patient with this diagnosis.